Today's debate is Republican Presley Stahl against Democrat Akira Anderson. Today's topic is health care. Ms. Stahl has the floor first.
The Democrats' Affordable Care Act, otherwise known as Obamacare, is unsustainable.
Today, about 16.4 million people gained health care. It has been working since 2010.
It may be working now, but it's costing taxpayers millions. The nonpartisan office expects Obamacare to cost $1.34 trillion over the next decade.
Ms. Stahl, do you believe tax money should go to wars?
Yes, I do. I believe in keeping America safe.
Okay, you talk on money, but did you know that every hour taxpayers in the U.S. are paying $117,035 an hour for war cost in Iraq, $4 million for cost of war in Afghanistan, $618,482 for cost in military action against ISIS. Also, there's a lot more. So that's way more than your Obamacare cost. Another point I may add is you want to keep America safe, correct?
Yes, I do.
Okay, so don't you think that no American should have to face financial destitution because they fall ill or get injured, stating that no one should have to choose between taking their ill child to the doctor or paying rent?
Miss Anderson, the money we spend on taking care of terrorism is necessary in keeping America safe. But this debate is not about funds. It's war funds. It's about health care. As for your argument about people having to choose rent or health care, this would not be an issue if they had a job. Job-provided healthcare is the #1 provider of healthcare. If Americans would get a job that provided healthcare, they would not need the government to pay for them.
Ms. Stahl, your thinking is utterly absurd. Not everyone can find a job. Also, do you not look up your facts at all? Not all Americans have or can get a job. Therefore, not all have health care. Health care has helped 16.4 million people. We made health care affordable. No American should have to face financial destitution because they fall ill.
I do understand that not all jobs provide health care. But if people had a job, they can purchase health care from a provider. That brings me to another point. Having the Affordable Care Act takes away the competition for insurance providers. When you're on the Affordable Care Act, you may or may not be able to keep your original insurance policy from those providers.
Ms. Stahl, for your defense on going to get a job, do you realize that healthcare is mostly given to middle-class families? Which means they do have a job. Wouldn't you want the help if you couldn't afford it?
Miss Anderson, I'm not saying that no one gets the help they need. There are many different programs that help those in need, such as Medicaid. Also, if everyone has access to the same health care, this causes inefficiencies, such as long waiting periods, substandard health care. It affects the physician-patient relationships negatively.
Ms. Stahl, no matter if you have affordable health care or not, you still have to wait. Waiting is a part of life. Even if it affects physician patients negatively, they still get help. It has affected people positively. Since 2013, the uninsured rate has declined 9.2% points for African American, resulting in 2.3 million adults gaining coverage, and 12.3 percentage points for Latinos, resulting in 4.2 million adults gaining coverage, 7.7 million gaining coverage over 55 million women with no out-of-pocket cost controlled on healthcare. Now, how many did you say it affected negatively? Because I didn't hear numbers, just ramblings.
I agree with you, Miss Anderson, that it's good that people are getting the care, but I do not agree with people who are working and paying high amounts of money get in some cases worse care than someone who barely is paying for insurance. Those who work and pay for their insurance should not have to wait hours in the emergency room because it's overcrowded.
Like I've said, no matter healthcare or not, you still have to wait.